We have three great presentations today. As I was saying before, I've seen these three platforms or technologies before. I think you guys are going to be amazed at what's happening here. With that said, we're going to go start off with StationMD, and Dr. Maulik Trivedi, we'll turn it over to you.
Great. Thank you. Can you hear me okay, Dustin?
Yes, we can.
Okay, great. First of all, I want to thank Dustin for organizing this. I've known Dustin for years, and I really appreciate the opportunity to present StationMD and our solution. I also want to thank Donald for having us on, and also thank you all for taking time to listen. I'm going to go ahead and jump right in, see if I can share my screen here, and you guys can see that? Okay.
Yeah, we can.
Great.
Perfect.
And I will also acknowledge that I see a lot of familiar names on the attendee list. And for those of you who've seen this, I apologize. You have to hear me drone on again about it. But I'm going to go through essentially what we do at StationMD. And again, I want to keep this very informal. If you have questions or you want to interrupt me, please, by all means, do so. Really, this is what our mission is at StationMD, is to really help elevate and achieve superior care for individuals with IDD, and we consider them a vulnerable population. We use telehealth to deliver that care. StationMD was founded by board-certified ER docs. I'm an emergency medicine physician myself, and we've been doing this for about 6-7 years, which in a way does make us telehealth pioneers, as it is a relatively new field. We have had thousands of virtual encounters to date. We treat individuals with complex medical conditions and issues, and unfortunately a tremendous amount of COVID-19 experience as well, both in the IDD population and outside. Many of our physicians still work in the ER and care for individuals. I want to emphasize that our physicians, of course, are board certified doctors, but they also are specially trained to care for this population. We go through a special curriculum that they have to go through, and also we have ongoing medical education for them, including chart reviews, peer reviews. We are currently providing our telehealth support to the IDD community in about 12 states. And we cover approximately 30,000 individuals, 24 hours a day, 7 days a week. And these are just some of the organizations that I'm sure you're familiar with. You know, we do consider ourselves advocates and thought leaders in this space from the medical perspective, and we're proud of our affiliation. And you know, we've spoken at some of these conferences back when you could actually go to them, and also virtually as well. And these are just some of the organizations that and states that we are currently participating in. You know, again, a lot of what I am going to say is probably very well known to you, but I just want to emphasize again to the group that, you know, this population tends to use the emergency department more frequently than others, or urgent care, for medical conditions that you're probably familiar with: seizures, pneumonia, GI issues, behavioral concerns. When they do land in the ER or doctor's office or urgent care, they tend to get admitted for a variety of reasons, which I'll touch on. The cause of this is they do have medical conditions and comorbidities such as pulmonary conditions, GI conditions that you or I may be able to be treated at home or over the phone, and this population cannot be. There is a lack of medical care available to this population. It's unfortunately a gap in medical education. Most doctors don't have any specialized training to understand the nuances of this population, both clinical and non-clinical. And oftentimes, even if they do have a primary care physician or a clinic that they go to, that physician may not be available or may lack the technology or modality to really do an evaluation without them being there in person. So, you know, I mention this all the time. I call it the trauma of transport. Just getting an individual to a doctor's office or ER urgent care is quite frightening. It's frightening for anyone, but for someone with sensory issues or that's nonverbal, taking them out of the comfort of their home setting is quite a traumatic experience. Oftentimes takes weeks to stabilize. Of course, I don't have to mention everyone is familiar with COVID-19, and that's still a real issue, not just for the individual, but for the DSPs as well, both formal and informal caregivers. You know, I put in here missed medication. I always mention this as individuals sometimes go to the doctor's office just to get a med refill because that's their only recourse. um, I would argue that the care that individuals receive oftentimes is suboptimal in the sense that when they go to the ER urgent care, there is no specialized training that this group of clinicians, not that they're bad clinicians, but they don't necessarily understand those clinical issues that face this population unless they have experience otherwise. So, it is unspecialized care. And again, I call it the trauma of getting them there. And of course, the exposure to certain viruses and whatnot. On top of it, when they get there, as you're probably familiar, they get tested. They oftentimes get hospitalized. And so it's suboptimal care and also excessive in terms of costs. Again, I won't dwell on COVID, but the one thing that I like to highlight here, which is unfortunate, is the recent study from the New England Journal of Medicine that showed that outside of age, having an intellectual disability is really the strongest independent risk factor for presenting with COVID and unfortunately dying from COVID, which should be absolutely alarming to advocates and the disability community in general. So what are the challenges for provider organizations? We all know the regulatory compliance issues. Sorry, I have a 2-year-old. Let me shut this door real quick. 1 second.
It's not a big deal. It's just kind of how life is these days.
Yeah. She doesn't quite understand the whole Zoom concept. So sorry about that. So again, the other issues are these individuals are complex. They require medical oversight. You or I, we may have a fever, but an individual that may have a peg tube or other issues, they are complex, and you're caring for individuals like this. And of course, I don't have to mention the staffing crisis, which is a national issue. And then we help with that in terms of engagement, providing support for DSPs, and really serving as a kind of a safety net. And again, this is just some of the other stuff that I've mentioned, the turnover issues, the job dissatisfaction. And when we started this organization, really didn't appreciate the real crisis of staffing. And I think it's only getting worse. So, telehealth is here to stay. You may have it through your own insurance or payer. I would argue that the value of telemedicine is even greater for those individuals that have challenges like the IDD community, challenges of transportation, challenges of lack of access. Keeping someone at home using a telehealth modality, I think, is even greater and more impactful for populations like this. With telemedicine, we can foster independence, allow people to live at home, and really, again, provide that safety net. And of course, access can be expanded quickly and safely. And again, the silver lining to all this is that it does actually reduce costs. So, the left are the problems, lack of access. As I mentioned, we can be in any part of any state as long as there is a Wi-Fi signal or cell signal. So there's no geographic impediments. And the suboptimal care that this population doesn't really receive the care that they deserve by trained clinicians. Our physicians have that specialized training. And on top of that, we also do have access to individuals' medical records and database. I mentioned this on all my presentations. I've been an emergency medicine physician for over 20 years. And prior to the start of Station MD, I would care for individuals who would land in the ER with the DSP who may or may not know them, with a big binder that I never read, that I don't find any of my colleagues ever read. And so we have access to the medical records when we do an evaluation, as opposed to just doing it without any information. And again, we're available 24/7. And oftentimes we're there to just provide documentation that you exactly what to do as a provider or a nurse or a DSP, but you just need a physician's blessing, so to speak. And we can provide that and serve in that capacity. We are not there to replace primary care. We're really there to handle emergent medical issues. So we will handle clarification or refill. We're happy to do all those, but we're not necessarily there to overtake or take over the role of the primary care doc, just to augment the care that they receive. In addition to the care that we provide, we have guidelines that we've created, from COVID-19 to seizures to falls to stoma care. As I mentioned, all of our doctors have initial and ongoing training to care for this population. And then we have an educational series that we provide all the organizations, that we tailor it to them. And again, quality reviews that we are very thorough in terms of the reviewing the medical quality and also the quality of the care and support that our services providing the organizations that we work with. It is very easy to use. Most of the calls that we get are facilitated either by a family member or a DSP. If you're able to jump on this call, you could use StationMD. We are a Zoom-based platform. Of course, it's HIPAA compliant. We have training, we have practice sessions. We have what we call a navigator that helps you connect to the doctor. And then, of course, we have support that's available 24/7. This is just a snapshot of what we call Station Connect. It's our back-end platform that we give access to. Whoever in your organization as a provider organization can see who called, who were the calls for, what were the calls for, what's the doctor's note. We put everything in here. It really serves as a very robust electronic health record and kind of a data repository for you to access. And this is just an example of some of the data that you can get from this. And again, we really tailor to the organizations that we work with to make it kind of relevant to their operations. And these are just some examples of the videos that are all included in our services that we provide: agitated patients, sepsis, wound care. These are the common things that we see, falls. And lastly, I'll run through the process on how it works, and I'm happy to answer any questions you may have if you have any. This was a real case that I like to talk about that we used StationMD for. A 24-year-old with cerebral palsy and asthma developed a cough and a fever of 101. The saturations were 90%. So that's the change in condition that you would normally either try to call the doctor or call 911 or take them to urgent care, whatever. In this case, you would call StationMD. It's a 1-800 number. We've already have you in our system. The navigator would then connect you with the doctor, either immediately or within minutes. And then me as a physician would initiate the virtual encounter. Down here, you see that icon. It's really one icon that you press, and we would initiate the virtual consultation. We have a Bluetooth stethoscope, which allows me to listen to heart and lung sounds and valve sounds. I perform my virtual consultation. We have a high-def camera, and I do my assessment. On the bottom, you can kind of see what it looks like. We also have an app, which I have to mention, which is you can just use it on your smartphone. And then after my evaluation, I come up with an assessment and plan. In this case, I thought it was an asthma exacerbation, a respiratory infection. I eat prescribed medications, which were delivered to this specific provider. In some cases, a provider picks them up. I called back in an hour. Breath sounds showed improvement. SATs improved. Everything I did in this interaction was documented in the electronic health record. In ours, if you don't have one, or in yours, we work with Thera, Precision Care, all of them, if you have them. And the primary care physician was also given this documentation. We would send that to them via HIPAA compliant text or fax, whatever we have set up. And all in all, a trip to the ER was avoided here. I could tell you, as I mentioned this often, is that this whole process maybe took half an hour. And, you understand the challenges of just getting this to an individual to an ER. Maybe you wouldn't even have transportation set up. If they would go to the ER, I could tell you it would be hours, and very likely you would have blood work done and a chest x-ray, and they maybe even been admitted to the hospital. Do want to emphasize that not all the calls we get are for emergent issues. We do med refills, med questions, a lot of COVID questions, constipation, UTI. These minor things turn into major issues if they're not addressed. I always mention constipation because if you don't address constipation, that turns into bowel obstruction. These are real issues for individuals with disabilities. Pulmonary issues, minor URIs or viral infections turn into pneumonia. So we want to be called about all those. Sorry, and lastly, I have these are the clinical and other outcomes. About 90% of the time, we keep the individuals in their home setting, meaning we don't need to send them out. And then these are just some of the examples of what we see, and the blue are the ones we avoid sending them out. The gray we send out, and you're probably familiar with all of these, and cough and falls and head injury and conjunctivitis. I do always emphasize that, when we do send someone out, we will call the urgent care ER in advance to let them know that the individual is coming. And it oftentimes expedites the care, helps eliminate some unnecessary testing. And it really just provides a doctor to doctor kind of feedback, and vice versa. If they're sending someone back, they tend to send them back if they feel that they are under the care of a physician that they know will be able to assess them in the next day or even later that day. And lastly are just some of the cost savings, which again, they really vary by agency, but they're quite substantial because it's you're spending time on ER overtime, sending someone, or urgent care. You have to send a DSP, you have to backfill a DSP. Some organizations pay for transport, some pay for lost beds. It really varies. And of course, the payer side, whether it be the state or the agency or Medicaid, they save a lot of money because again, we are averting ER visits and urgent care visits, and those are expensive. And I believe that's it. This was just a partnership we had with a payer. It's not really relevant for this conversation, but we ended up saving them a lot of money simply because, again, we are averting costly healthcare visits and addressing the individual's needs in their home setting. I think it is more robust care, better care, but of course, it also results in a decrease in healthcare spend. I'll put my name in the chat and email if you need to ask me any questions, but I will stop there. I think I have a few minutes. If there are any questions, I'm happy to answer those. And again, thank you for your time.
Thanks, Dr. Trivedi. I always say this every time I hear you present, I was a DSP at one point back in the day. And that was always my biggest concern is, an early 20-year-old guy that had no medical training whatsoever. I'm alone with these 8 people. What if something happens, a condition changes, and I'm there stuck? Do I take the person to the ER? Do I call my supervisor and wake them up? Having you guys there as a backup would have been such a relief for me as a DSP, beyond obviously the benefits to the person served. So I love what you guys are doing. We did have one question in the chat, and it was, in your opinion, what could medical schools do to teach more about IDD populations?
Oh, that's a great question. So I'm actually, in fact, working with what's called AADMD, and they are a very progressive organization that are trying to get this in the medical curriculum of certain medical schools, and they have made some progress. I don't know the specifics, but they've dedicated certain hours to this training, which I don't think is enough. What I do think should happen as you do clinical clerkships, you do a month in cardiology, a month in peds. I think it should be mandatory that they set aside some time where you spend X amount of time in a group home or in any capacity caring for individuals that have an intellectual developmental disability. Just the touch point of understanding them and their needs, and understanding that you can't just paint an individual by their disability. Just because someone has cerebral palsy doesn't mean that they have some intellectual deficiency. So I just think exposure and more of it, just that alone is a first step just to get some cultural competency so they get that. But the clinical side, I think there needs to be more emphasis on the clinical needs of this population because it is different. They do have issues that this population faces that you may or might not, it's called the fatal 5. Things that are not lethal in normal adults are in this population can be. So just that education component should be part of their education.
Another question says, do you accept Medicaid?
Good question. It's kind of a moving target. Every state's unique, but we are working on that. Telehealth reimbursement is kind of in this flux. I wish I could give you a straight answer for that, but it really depends on the state and it depends on the payer, I guess, so to speak. And it also depends on once we get out of this public health emergency, because right now there is some flexibility in terms of reimbursement because we're still in this emergency type setting. So.
Wonderful. Dr. Trivedi, thank you. Good seeing you again.
My pleasure. Thank you all so much, and I appreciate it. Take care.
Yeah, thanks a lot.
Yep.
All right, well, let's keep going. We've got another amazing solution here. We're going to turn it over to Elena Gallagher with Dose Health to go through the solutions that they have.
Wonderful. Thank you so much. And Dr. Trivedi, that was really, really wonderful. I think COVID definitely exposed this massive need for telehealth that was already there before. And it's really cool to see that data. It's very, very fascinating. So thank you for sharing that. The solutions that I'm going to talk with you guys about is more specific to medication management. So we specifically work with individuals to help them manage medication safely. We work with staff as well. So it's kind of this mixed approach Our goal is always to help increase independence while maintaining safety. And in some cases, we're actually seeing a lot of safety increases as well in that process. So what we have, I'm not going to do a PowerPoint for you guys. I apologize. I'm going to do everything live on video here. So what we have is we've got a smart pill box. And the idea with this is, again, really just to help people manage their medications in a safe way while ensuring that they're getting the correct medications at the correct time. It's also going to be able to report out if caregivers need to be involved. So the way that it does that is there's a cellular chip built into the device that allows it to report, send something like a phone call, a text message, maybe an email to a caregiver, letting them know something like, hey, maybe it's been 30 minutes and this person hasn't taken their meds yet, or it was 2 hours and the medication was missed. Other things that we have too are around potentially somebody trying to tamper with their medications. We work a lot with the developmental disabilities population. We work with people who live in their own homes, who might have physical disabilities or the aging. And we also work with people who might have a history of medication abuse or addiction, or be at a high risk to potentially abuse medications. So we work around safety and security with medications as well. The way that we can do that is the device is lockable, but working with the population, we've understood that people can get kind of creative when it comes to trying to get medications when they're not supposed to. So we've actually built in some sensors that can be tied into those alerts as well. We've actually found that these same sensors allow for sometimes the allowance to give an individual maybe living in a residential facility more upfront control, but still have that staff kind of monitor and make sure that they're doing things the way they're supposed to. So those alerts can be if the lid is ever removed when it's not supposed to be. So if the device was unlocked, or if the device was locked and somebody broke past the lock, there can be an alert sent to say that that lid was removed. The other one then is to be if somebody tried to ever like force a tool or something like that into the device to try to manually shift the internal tray to get access to the medications, there is an alert for that as well. In addition to the fact that there's almost like a locking mechanism with our motor to prevent that from happening. But just in case, again, like I said, we see people get very creative. So that's kind of the background of everything that can kind of happen in the background of the device. But on the front end, like I said, our big goal is to get individuals more involved with their medication passing, or if they're living on their own and they're at that point where medication pass management has just become really difficult. Maybe we're seeing a lot of increased hospitalizations, or just their conditions aren't changing or they're getting worse. So then it's something that we start having the conversation around how they can use the device to maintain their independence or increase it if they're living in a more supported environment. So the way that the device works is it is set up for an individual specific medication schedule. So at the scheduled medication time, the device is going to rotate open, and it'll only open up to that specific med compartment for that specific med time and day of the week. And then there are options to have the device sound an alarm or flash light to remind the individual when it's time to take their medication. To dispense meds, there are a couple of different options. People can just pick up the device and flip it over to dispense the medications. Or we also have adaptive equipment to help aid if somebody's going to have a harder time picking up and flipping the device over. So this is an adaptive flipper that the device can just kind of sit cradled in. And then the person can use this to flip the device over, and it's going to dump out into the med cup below it. So the idea with that is to really help with people who are going to have a harder time picking up and flipping over the device. Maybe it's because they've got pain, shakes, tremors, anything like that, or loss of limb or limb control. So the goal is really to make the service more accessible. And as a company in general, we really firmly believe in accessibility. We never want something that we don't think of to prevent somebody from gaining access to our services. So we always tell people to let us know. We learn a lot from the community that we work within about how we can improve our services and allow that for their access. And we kind of go by the motto of we don't know what we don't know. So feel free to tell us, because it's the only way we can learn. We don't want our shortcomings in not understanding or not having thought of something to prevent somebody access. So That's one of the big things that we look at. Some of the things that we focused on with the service in line with that is really making sure that we can specifically set up the device to fit an individual's needs. So we tailor it to that individual's particular setup, not just based on their med schedule, which obviously would be something that we would be setting up to reflect when they're supposed to take their meds, but also things like maybe sensitivity to flashing light. If there's a seizure concern or anything like that, we can turn flashing light off. And alarms. Alarms can be turned up, down, or completely off. If they're not going to be effective for somebody, either an individual is deaf or hard of hearing, and that's not going to be something that they want the alarms going off for, or the alarms are just going to be triggering, uncomfortable, or maybe even just so annoying that that person really is just not going to be interested in the service at all. So we have the option to use those notifications from the device to actually remind the individual via a phone call or text message, if that's what's preferred. It'll send them a message then when their medication is, it's time to take the meds. And then again, it can keep sending them notifications, again, via phone or text message every 30 minutes throughout their med time until they actually dispense those meds, and it tracks that they were dispensed. So that's just one of the options. Some of the other things too is, again, with the adaptive equipment, some people use the adaptive flipper to help angle the screen up towards their eyes and then make that flipping a little bit easier. But if somebody doesn't need that full system, they also have the option to just use a stand. And the idea with the stand is to help angle the screen of the device up towards an individual's eyes. So that flashing light makes it a lot easier to see, rather than sitting flat on a surface where that flashing light's going to just dissipate up towards the surface and not do much. So that's kind of the basics of how the device works and how we can tailor it to fit an individual's particular needs. We do have the option to have a PRN mode on the device as well for people who are taking those as needed medications. Where setting them up in a scheduled pill box does not necessarily make sense. And the way that that PRN mode works is it's actually set for what we call a wall. So we would set, if it's like a pain pill I can take once every 6 hours, I would set a 6-hour wall. And I would, if I like took my pain pill at noon, I wouldn't be able to take it again until 6 p.m. But at 6 p.m., it's not going to turn on alarms or flashlight or do anything to remind me to take that medication, because that would defeat the purpose. Instead, it's just going to turn on the allowance on the machine to let me take my meds at that point in time. If I don't think about it though, and I don't actually need my pain pill until say 7:57 p.m., from there, it's going to reshift that 6-hour wall out ahead of it. So I wouldn't be able to take it again until 1:57 a.m. So that's kind of the idea with that PRN mode. And that wall can be set anywhere from 5 minutes to 24 hours. So it's very, very flexible on the way we can set up that PRN mode. Yeah, that is everything that I have for the device itself. I know a common question that we get is how we cover situations where, like, if somebody's taking non-pill medication that don't fit into the device, what can we do for that setup? And we actually have automated phone call and text message reminders that can be used for anything. It does not have to be medication or necessarily health activity related, but that's what a lot of people will use in supplement too. So it'd be like a text message or phone call reminding somebody to take their insulin, or liquids, topicals, eye drops, anything like that. We also do like a ton of activity reminders in general with those, but that's a lot that we can do to kind of tie in the full medication process, because it's not always just pill medications that somebody needs to be remembering to take. I'm going to leave it open then to see. I thought I saw a couple of questions come in on the chat.
Yes, I'm trying to keep track of them. I believe you answered the first one, but just in case you want to add something to it, the question from one of the attendees is, does the device have flexibility in a way if the individual has a set time to take their meds, but then they go out somewhere and do not get back in time to take their meds on the time that was scheduled?
Yes, that's a great question. So we actually have, so the standard is for that set schedule, it's 2 hours to dispense the meds. So we do that to kind of mirror that hour before, hour after for standard facility med passes. But we do have an early and a late dispense features that can be turned on. You could have both turned on, one turned on, or none turned on, depending on that person's scheduled med the flexibility of like, if those medications might interact later in the day, maybe you don't want a wide open window, but there is the option. So with an early dispense option, they actually have 8 hours before the scheduled med time to take their medication early. When they do that, it's going to track that they took that medication. So it won't do anything to remind them at that point in time when that scheduled med arrives, because it's past the point they've already taken it. The late dispense feature will turn on only if they haven't dispensed the meds in that early dispense or during that scheduled med time. And then it gives them an additional 2 hours after that missed med alert. So essentially somebody can expand it where they have a full 12 hours to dispense the medications if they've got both of those features turned on.
And another question that came up was about what the setup looked like. Is it on a computer? Is it on a smartphone? And before you answer that, I've been to your website. I've seen your presentation before. If you can make sure you drop in the chat later, the website, because I know there's plenty of videos that show setup and things of that nature. But that was one of the questions, was setup on computer and phone, smartphone.
Yeah, absolutely. So nobody needs to have a smartphone or a computer to use the service. The way that it is set up is we've got a couple of different options. We will always work with, thank you, Dustin. Dustin actually just sent out the website too in the chat there. But the way that we work with the setup is we'll work with the individual and whoever should be involved. So a caregiver, care team, to help train everybody on that. And it's kind of dependent on what that group wants for the training. We can either do phone setups with them where we ship the device out to them and walk them through that setup process. Everything can be set up directly on the device itself. So again, you do not have to have a computer or a cell phone or anything. Otherwise too, if people wanted to do a live video conversation like this, we're happy to do that. And then last would be, we've got those kind of pre-recorded videos that Donald mentioned that are on our website. Some people will opt for those because they want to try self-setting up. We've worked really, really hard to make sure that that setup process is very, very straightforward and simple. It's a guide right on the screen of the device that walks everybody through exactly how to set it up. But just in case, we always set ourselves as our support team a follow-up to reach back out in 2 weeks to make sure that that person did actually set that device up. So we can see that by seeing that it came online. If it's online, we'll reach out to them and see how things are going, see if there are any questions. If it's not online, we're going to probably try to schedule a phone setup or video setup with them at that point, just to ensure that they're actually using it. We're very, very firm believers in getting people set up with a service that actually works for them and works for them. So we don't want to set something up for somebody that's just going to be kind of a useless service for them that sits in the closet and is never used. So we actually do every 2 months connection check-ins to make sure people are using the services, make sure that if it's not connected, we'll reach out to them and figure out what's going on, if there's something that we can help with, or if they've decided it's not a great fit for service anymore and they want to cut that service and stop using it. So we never ever want somebody to use their waiver dollars or their personal out-of-pocket dollars towards a service that they're not using.
And another thing, I had it on my list because I figured some people may be asking that, but I see it popped up as well. What battery backup for the device if it goes out, and also if there's no cellular signal in the community, how does that work? How does notifications work under those situations as well?
Both fantastic questions. So the device is actually fully portable. So there's a built-in rechargeable battery. If you unplug the device or if electricity goes out, the battery will kick in. It'll go into kind of, we call it travel mode or sleep mode, essentially. So it preserves battery life. We generally tell individuals when they're actively using the device, it's about a 3 to 4 day battery life. We do have it programmed to be 7 days if people aren't waking it up very frequently. We just find more often than not, people are waking it up to kind of check, see where they're at, all of that. So about 3 to 4 days for the average battery life. If it were to ever completely die because maybe the electricity's been out for a longer period of time, or maybe somebody went away for a weekend that turned into a week and they didn't have charging cords, one, they could always call us. We've got our phone number big and bold on the back of the device. And if they're going to be somewhere for a couple of days, we can send them out an extra cord. There's no cost when people need to get a hold of us or need extra equipment or anything like that. That's all part of our service. So we would just send them new cords. But if it were to completely die, it does not reset the device. as soon as they plug the device in, it's going to jump right back on track. It'll know their schedule. It'll know which medication should be coming up next, and it'll open up to that when it's the scheduled time. So it doesn't reset or anything like that. And then Donald, your question about cellular coverage. So if there is not cellular coverage for the device, for those live notifications to go out, we do have a Wi-Fi device available. So that one we would hook up specifically to the Wi-Fi where that person lives. So it's going to more allow those live notifications when they're in the home. So if they're out and about traveling, it's not going to send live notifications necessarily until they return home. Then it'll do a data dump and load that data into the system, but it wouldn't be able to do those live alerts unless they were actively connected to that Wi-Fi. So we can always test cellular connection too. We've got like obviously like connectivity charts and stuff like that to see. And then when we send the devices out, if we're not seeing it connected, but that person's actively using it, that can be a good indicator that maybe they're not connected. The device itself will still fully function. It'll still be on its med schedule, still open up and do the reminders for the individual at the scheduled time without cellular connection. It's just like Donald mentioned, not getting those live notifications if that cellular connection isn't in place.
Yeah, and I have to say one of the things that really stands out, a lot of things stand out, but one of the things in particular is the portability of the device and thinking about our folks who are in the working class, and if they need take their meds, need that reminder, they can still be in their work reminder, receive the alert, and then go and get the device and take their meds and things of that nature. And just now with the environment we're in with COVID, what is the potential for using dose and med administration for people at home, and still possibly in tandem with remote supports, have that oversight or guidance if need be.
Mm-hmm, absolutely. And some of the things that we've seen that have been kind of some huge benefits that, again, from the system that we were putting in place more to help people be engaged with their medications, if we were looking at residential home settings where maybe it was 24/7 staffing, but this individual wanted to set goals towards being involved in their medication. We found that on top of getting that increased independence, which was really huge, we were seeing a reduction in medication errors by over 50% in those homes. And the staff time, which has been something obviously very, very much needed with the staffing crisis that we're seeing nationally, that staff time was cut by about 75% from what it took them to do a med pass. So it went from on average about 30 minutes for a 4-person home to 5 minutes for a med pass. So really, really significant changes. I think I've got my numbers correct there, but it was something like 3 to 4 hours per day went down to an hour per day for total for all med passes in the home when they were set up with the device. So that was something that we weren't anticipating being the outcome, but it was a really great outcome because the goal with that then is that that staff can redistribute that time to spend more time with the individual, maybe focus on some other things, not just cares, maybe an outing or doing something safely. On top of that, one of the other things that we saw that was really incredible is safer leave of absences. So if they wanted access to the community, they now have a safer way to do that. So like you said, Donald, being able to go to work, or in some cases, being able to visit a family member who maybe in the past hasn't been very good at managing their medication, so it became an unsafe environment for them to visit. Now it gives them that opportunity to have their meds safely pre-packed and pre-filled in a secure container that's going to keep that, if the family needs to be involved, keep them on track with remembering to give the medications, or if that individual is fully self-managing, that individual is then responsible to take their own medications in a safe way. So.
Great. Well, thank you so much for joining us. And please, if you could drop your information in the chat. I know I'll be in contact with you as we continue to explore options. But yes, thank you so much.
Thanks, Elena.
Thank you.
All right. Well, we did throw a link to Dose Health there in the chat for those of you that are interested in some of the videos that Donald was talking about. So go check that out. We have another great presenter coming up here, Henry from Spirit Club. I was extremely impressed when I first saw this, super excited to see that somebody was actually focusing on exercise and kind of universal design of exercise. So Henry, I'm going to turn it over to you.
Great. Thanks so much, Dustin. Thank you for having me. Donald, thank you for having me. To the first two companies, incredibly impressive, and you're doing great things. And Grace, thank you for interpreting. I hope I speak at a good pace. So everyone, thank you so much for joining this meeting and for being interested to hear what we have to talk about. I'm excited to tell you all about Spirit Club. Spirit Club is a company that believes that fitness and healthy lifestyle opportunities should be for everyone. We were started back in 2012, back long before we had any idea about what COVID-19 was, and we were an in-person company and everything was wonderful. We were started when our founder, a guy named Jared Seener, was working as a support counselor for people with disabilities. And he was doing that during the day. And at night, he was working as a personal trainer at a gym, just an average big box gym. And he noticed something very sad and unfortunate, which was so many of the people he worked with during the day had some type of fitness goal, either to lose weight, get to walk more, improve on balance. But the gym where he worked at night was not supportive to them. They did not feel comfortable there. And he realized that for so many people, including people with disabilities, seniors, people who can't afford exercise services, for so many people, fitness is not, and fitness support is not available to them. And because of that, he started teaching an exercise class just for the people in his program. And he based the class on this idea of universal design, so that anyone with or without a disability could participate in the class and get a meaningful experience out of the class and get a workout and do something healthy for themselves. And the class was a big hit. So one class a week turned to 2, turned to 3. Eventually, he spun this idea of these classes off into Spirit Club. And in addition to doing these group classes, he also started teaching personal training. We hired some trainers, opened a gym, and everything was going great. A few of the important things for Jared at the time, one of them was he realized he was so effective at teaching exercise to everyone, because he not only was a certified personal trainer, but he was also certified and trained to be a support counselor. So because of that, now any trainer that Spirit Club hires has to be a certified personal trainer. And then we sponsor them to get the same training that support counselors get, so that our trainers can really be experts in both fields. Another big thing for us is we want the people who are teaching the classes, the people who are taking the classes to be reflected in the people who are teaching the classes. So there are people with and without disabilities who are taking the classes. And because of that, we hire trainers with and without disabilities to teach the classes. So everything was going great. One thing I didn't mention was that we're located in Kensington, Maryland. That's our home base. And up until right around March 2020, we were completely an in-person company. We were working with about 350 people every week. And we were partnering with about 25 different organizations to teach classes for the people that they supported. And everything was great up until the pandemic. And then the pandemic hit mid-March, and we had to close our gym. We had to stop doing in-person services. And for us, that was, pretty much everything we did. So we had to quickly adapt, and we became a virtual company. And the meat of what I'm about to talk about is talking about what Virtual Spirit Club is. But I will just tell you that this was actually something that turned out to be very positive for our business, and it allowed us to reach so many more people. We're not just a Maryland-based company. We now work with people and organizations in 33 different states. And on average, our classes reach about 4,000 people. So this new virtual model has allowed us to pass on supportive fitness to people who were really not getting it. And so that's something that we're very proud of. So a big thing, and one more benefit is as you'll see, the technology has actually allowed us to get even better at and get even closer to the idea of a universal design. And that's something I'll show you in just a few moments. So when in mid-March, when we were in kind of a frenzy, what are we going to do? How are we going to turn into a virtual company? We started thinking about the needs of our members and the needs of our partnering organizations. So for our members, so many of them were people with disabilities who might have other health concerns and who just in general would be very susceptible to the effects of the virus. And because of that, they're people who are going to be sheltered in place, staying at home. They would not be able to go to their jobs if they had one. Their day programs were closed, and they were at a real loss for activities. They just needed things to do. Then when you look at the organizations we work with, like day programs, the day programs all had to completely shift their model as well. They had to change from a completely in-person operation to and an operation that for most people were in the communities to one that was virtual, or if in person was just in the building. And they themselves were in great need of programming. So our idea was, what if we were a provider of very high quality, supportive, fun programming for both individuals to use to fill their days and organizations to use to fill their virtual day programs and their in-person activities. So we came up with this idea that we would create something we call our daily community classes. And the idea behind the daily community classes is that we have a set of classes that we're making available to all of our members and our partnering organizations at an unlimited capacity. So anyone who is a member or a partnering organization can use as many classes as we want, however many times they want. So I'm going to start the screen sharing portion of this presentation. So it's going to get fun. First of all, what you're looking at now is a look at the classes that we teach on a regular basis. And you'll notice that we try to have a variety of our classes so that there's something for everyone. And also a great variety in our classes so that if an organization uses or a person uses our classes every day, they can fill their week with different things every day. So at a high level, we have 3 types of fitness classes. We have 2 types of yoga classes. We have a Zumba class, a boxing class, a meditation class, a healthy cooking class, a fitness class that's 100% in Spanish. And our newest class is one we're really excited about. It's called Spirited Sam's Spirited Jam. And it's a class that is taught by one of our trainers, Sam, who is incredibly fit. He's run 7 marathons, and he himself has autism. And so it's just amazing to see a self-advocate teaching classes for other people with disabilities. And it's an incredibly fun and energetic class. So these are the classes that we teach on a regular basis. And I'm going to now share my other screen, and you'll see this is our website. And the website is the hub for everything we do. And when we were coming up with these classes, we knew that we were going to be dealing with people who have a lot of totally different backgrounds. And we could not create a one-size-fits-all solution. So instead, a solution with a lot of flexibility, and I'm going to briefly go through that. The first is when classes can be watched. Classes can be watched either live or on demand. So I'll just show you the on-demand page. This allows our classes to be watched whenever you want, day, night, weekend, weekday, and it builds in a lot of flexibility into the classes. You can watch whatever class you want. Here are 11 most recent classes for our 11 class topics. You can watch these classes whenever you want, whatever class topic you want. So these are the most recent classes. And down here we have the library. This is the repository of all of our previously filmed classes. And the classes are, not only are they available whenever you want, but you can do these classes wherever you want. And what I mean by that is our classes are designed to not require any equipment. So you don't need weights, you don't need machines or stretch strings or whatever. All you need is the only thing you need is have a chair close by and some water. And other than that, we just teach you how to use your body weight and to make exercises easier or harder. So that's how our classes can be done any time and anywhere. Now I'll show you how our classes can be done by anyone. And what you're seeing right here, this is an example of our multi-trainer model. All of our virtual classes have multiple trainers teaching them. One of our trainers will be teaching the baseline or beginner version of an exercise. Another trainer will be teaching the seated version of an exercise, and a third trainer will be teaching the standing or challenge version of an exercise. By having multiple trainers on screen, it allows for anyone to turn on the Spirit Club class and find a trainer who is there to, who's going at a pace and in a modified form that fits their need. And it also allows people to exercise together. So I could be exercising with someone right next to me in the same room, or with someone in a different place over Zoom, and I might follow one trainer and that person might follow another trainer, but we can still exercise at the same time and have that shared experience, which is great for social aspects. So I know everyone here has been sitting for about 57 minutes now, and I was thinking what I could do is turn up the volume and we could all do 1 minute of exercise. So I'll pause just so that I'll keep it going because I know we're at limited time, but anyone should feel free to go. This is a chair squat. These are fun exercises. Don't be self-conscious. I'll do it also. Dustin, feel free to turn your camera on, do it too. And let's just have a good time. So this is what one of our classes sounds like.
See if you can do it without. Stand up tall, sit back down. Now, if you're more comfortable staying in your chair, you're gonna follow the exercise like David. David's gonna do a shoulder press. So David's reaching his hands up to the ceiling and back down. Great job. Awesome. And Marcella, she's doing both of those movements. The chair squat and a shoulder press. Good. So every time she stands up, she's going to press up to the ceiling. Perfecto. If you're following like me, just focus on the legs. Focus on the stand. Keep your abs nice and tight. Keep your back straight. See if you can get your hands off your lap. If you need to use your armrests to push off, that is totally fine. And you can do your shoulder press like David if you want to stay in your seat. Awesome job. We only have 20 more seconds. Keep on breathing. 4:20. 19. Great job, Marcella.
All right, everyone. Thanks for participating. Thank you, Dustin, for being my model. I assume that the 85 of you who I can't see were also participating. I would have loved to go to the end of this, but I know we have limited time. So a few other quick things. All of our classes not only have these 3 trainers, which accommodate different fitness levels, but we also try and accommodate different needs. So for instance, we teach very simplified forms of exercises to make it so that anyone can follow. All of our exercises have 1 or 2 steps. Stand up, sit down, stand up, sit down. Touch your shoulders, touch the sky, touch your shoulders, touch the sky. So we try and do that to remove any complexity. We wear certain things to make sure we have good contrast for people who have vision impairment. We always try and have very good verbal descriptions for people who have vision impairment. We integrate in captions and sign language for people who have who might be deaf or hard of hearing. So we're trying to make these classes as accessible for as many people as possible. All right, I'm going to stop sharing. Actually, and one thing I'll do as I just finished talking is I'm going to play one more video, and what you'll see here, these are a few videos from all the rest of our classes, and you'll see for each of these classes we have multiple trainers with these same different 3 levels of classes. So we have fitness, boxing, Zumba, yoga is probably coming up. Yep. And we just have some of the best trainers, and Spanish fitness, which is a relatively new, really fun one. We do a lot of themed classes. This is a new one we're about to premiere. We did a storytime fitness class based on The Wizard of Oz. Healthy cooking, where we teach people how to make things that are healthy and that they would actually want to eat. And then here, this is some videos of some of our individuals using our classes. And you'll see we have individuals who use our classes at home, and it's some people base their days around it. And then here, this is an example of a watch party where we have organizations who are using our classes. And this is an organization that had a few different locations, and by using our classes together as in a watch party, they can all exercise together. And then this is another example of a watch party where individuals are logging in from their own homes, and they're all doing a boxing class together. So I'll mention two more quick things. I know I'm running up against time. The first thing is pricing. We never want our services to be to bring financial hardship on anyone. So we have what we call a pay what you can model, where we have a full price for our services for individuals or for organizations. And if that price is too high for you, no problem. You can just pay what you can, and we will accept what you pay. And you can pay as low as $1 a month, and you can get all of our services included. So we never want cost to be a reason that things don't work out. And the last thing I'll say, because of the audience I'm talking to, Spirit Club is a DDS provider, and we are an HSCSN provider. And we fortunately, we are able now to open up and do some personal training and partner training, which is personal training with 2 people. And we're doing that with some HSCSN clients and some DDS clients. So we are here for you. And thank you very much. I hope this was within my time limit. And thanks again, everyone.
Perfect. Thank you, Henry. Really appreciate it. I didn't know that I was going to be getting involved, but I'm glad that I did.
Yep.
I could probably use it after the COVID.
Oh, you got your workout for the day, or at least
the
40 seconds of work.
the pay what you can pricing model is just amazing to me. And I know we've talked about this before, but that it is actually working for you guys, that people are more than likely pretty honest. And so commend you guys for doing that and making this available to more people. Donald had a question. Donald, do you want to ask your own question? Or
Yes, absolutely. Hey, Henry, great presentation. And before
Thanks,
I
Al.
ask the question, can you make sure to drop your info about Spirit in the chat? My question was, I guess, moving forward, has the Spirit team actually considered gamifying activities around when people reach certain milestones or something? I've seen that done on other platforms, with, in particular with exercising, how they kind of incorporate that in.
Absolutely. Yeah, we are at an interesting crossroads right now where, God willing, the pandemic is going to wind down. And we have to see where will people land on how much virtual they're going to keep in their life and how much they'll go back to in person. And our strategy right now is to explore every avenue. So we're trying to make we're doing new classes. We're providing value-added content. Like last night, we did a event for International Seeing Eye Dog Day, where we had speakers come together. And gamification is something that we're looking into as well. And we look to some of these bigger, more established fitness companies like a Peloton, like a Beachbody, that have kind of already done the trial and error, and we're seeing what's worked for them, and we're trying to integrate that into our system. So we do expect that would be something that within the next month to 2 months we would be rolling out. So awesome. Good question.
Yeah. Thank you.
So for people in DC, you had mentioned that you are an enrolled provider.
Mm-hmm.
How do they take advantage of your services through the waiver in DC?
So I would, we're still a little new to the DDS sphere. So I'm sure I'm gonna butcher the terminology when I say this, but I would reach out to your support coordinator and mention Spirit Club to them. And Dustin and I both just put our website in, and I just put in our email address, join@spirit-club.com. And we would love to get in touch with either you or your support coordinator, whoever. And if you're interested in personal training, what we do is a free consultation where we can see where you're at, and we can develop a plan for you. And if you're interested in the group classes, we can give you a free trial on them as well. So we would love to meet you, talk to you. And best thing is we're covered by the waiver. So this can be something where you can improve your health and integrate in some exercise into your week at a cost that can be very affordable for you, or no cost at all.
Yeah, and you were close, Henry. Service coordinators is the role here in DC.
Okay.
And I assume that you're a fitness training waiver provider in the district.
Maybe, yeah. I just know we're DDS and HSCSN, and yes, I mean, I know that on our approval letter it says fitness services, so that probably is what you're talking about. So, yes, thank you.
Yeah, and what I'll do is definitely we'll continue to work together to get awareness out and that flow stream for requesting the service, which usually is, the team gets together with the service coordinator, engage the provider, and move forward with authorization for the service. Yeah. Do they give assessments and reports for each person?
We do. Yeah, we have a HIPAA compliant software where we and our trainers all, because we were HSCSN providers for a while now, so that kind of trained us on what needs to happen with reports and assessments. We have a physical therapist on staff who assesses a person at the beginning of their membership with us, and then periodically throughout. So yes, we do assessments and we do reports.
Awesome. Yeah. I don't see any other questions. Do you, Dustin?
No, we did have a question that says, do you have to go through DDS to get the service? And I'm assuming the answer is no. You can.
Yeah, the answer is no. We know other funding sources that we can connect you with to help cover some of our costs. And with all of our virtual services, as I mentioned, we have the pay what you can model. So please, if you have any interest in even just talking one-on-one, you can reach out to either through our website, spiritclub.com, or my email address, join@spirit-club.com.
Outstanding. Well, thank you, Henry. I'm going to go make myself homemade mushroom spinach pizza now. You made me hungry.
Please do. Yep. All right. Thanks, everyone. I really appreciate the opportunity.
Thank you very much. Well, I hope that today's session on healthy living tech was beneficial to everyone. Please feel free to reach out to any of the presenters. Both Donald and I'm assuming, would be willing to answer questions or get you connected with those folks. So thank you very much.